Eugene could once again have its own emergency room after the only ER in the city was closed down last December. KEZI 9 News reporter Albert James shows us the plans one local hospital group is putting together and how Eugene residents are reacting to the news.
We know there's a lot of great urgent care centers, and we appreciate that, but this would be a 24-hour, 7-day-a-week freestanding, or what we call a satellite ED.
Speaking at a community health forum in Eugene Thursday night, McKenzie-Willamette Medical Center CEO David Butler said he was working with local leaders, investors, and developers on applying for and designing an emergency department in Eugene.
Initially, we're looking at about a 12-bed satellite ED. It would have the ability to grow and expand based on the site that we're looking at.
That potential emergency department would fill a void left by the closure of the ER at PeaceHealth University District last December.
We have two really good hospitals in this community. Unfortunately, they're both in Springfield. And even though it doesn't take you an hour to get across town, it's a disadvantage to have to drive all the way over to, McKenzie or Riverbend to get health care.
Butler says his team settled on a site somewhere in West or South Eugene, though he wasn't clear on exactly where that would be.
Don't want to tell you about it because you might go out and buy it. But it's got great access. Over 25,000 cars go by there every day.
Eugene residents I spoke with say it's crucial to have an emergency department on this side of the river in hopes of reaching the people who can't make it to the existing ones in Springfield.
It just seems like a very irresponsible thing not to have some kind of complete emergency room here in Eugene as well.
Gibby Bridge tells me she's been concerned about the distance people in Eugene would have to travel to Springfield for emergency care and how an earthquake could impact routes to those ERs.
There's also people who don't have cars and are reliant on public transportation and probably don't have the ability to pay for an ambulance.
Tobias Lehman echoed the importance of accessible care.
We need on this side of the river urgently an emergency room, that protects people. There's no doubt about it, actually, and it's an important part of the social welfare of the city.
As for when an emergency room in Eugene could open,
once we get the design and build phase done, we're probably looking about a 2-year or 2.5-year construction time frame.
Reporting in Eugene, Albert James, KEZI 9 News.